This week, Ed Gaudet from Sensinet is with us to discuss security challenges in healthcare. Then Tanya Janka from SemGrep joins us to talk about her new book. Finally, in enterprise security news, we've got some funding and acquisitions. Ransomware payments are down 35%. Info stealers on Macs are up 101%. Bybit got hit by a $1.5 billion heist and shrugged it off. A SaaS report says AI is having no impact on pricing. Microsoft's CEO says AI is generating no value. Google is dropping SMS as a second factor. Finally. Google creates a fourth state of matter instead of fixing Teams. And what it's like to be named null. All that and more on this episode of Enterprise Security Weekly.
This is a Security Weekly production for security professionals by security professionals. Please visit securityweekly.com/subscribe to subscribe to all the shows on our network.
It's the show where we talk security vendors and aren't afraid to name names. It's Enterprise Security Weekly. Welcome to Enterprise Security Weekly and happy National Clam Chowder Day. This is episode 396, recorded on Thursday, February 24th, 2025. I'm your host, Adrian Sanabria, and joining us is the Dean of Data Science, the Knight of Neurodiversity, the Watcher of Data Center Waste, Jackie McGuire. How you doing, Jackie?
It feels like second Monday, but
hang in there, Jackie.
In general this week, I don't know. It's a slow week for me.
Go get some clam chowder. You'll be fine. Also with us, we've got Mr. Ryan Freed. How you doing, Ryan?
Good. Happy to be back.
Part of our panel of emergency co-hosts. Lovely to have you join us. Hope everything's going great for you, Ryan.
Yeah, we're finally in the spring weather in Portland, so couldn't be better.
You have clam chowder over there? Or is that just an East Coast thing?
Yeah, I think more of an East Coast thing.
Okay, more of a crab bisque or something like that over there, maybe a chia pino or something.
Yeah.
All right, we've got a quick announcement for you, and then we'll jump into the first interview. Identiverse 2025 is returning to Las Vegas this year, June 3rd through June 6th. You can hear from over 250 expert speakers and connect with over 3,000 identity security professionals across 4 days of keynotes, breakout sessions, and deep dives into the latest identity security trends. Plus, take part in hands-on workshops and explore the brand new non-human identity pavilion. Not sure what that means, but check it out. Register now and save 25% with code IDV25-SecurityWeekly at securityweekly.com/IDV2025. Today's topic is security challenges in healthcare. We're excited to have Ed Gaudet, the CEO and founder of Sensinet, with us today. Sensinet is a platform dedicated to improving cybersecurity and risk management in healthcare. Welcome to the show, Ed.
Thank you. Thanks for having me. And New England or Manhattan clam chowder? I guess that's the first question.
New England.
And I have forgotten what the difference is. Yeah.
Tomato base versus
disgusting.
Cream base. Yeah.
Legal seafood
really?
or nothing.
Yeah.
So is it the presence of Italians? Is that the difference?
Could be. It's interesting. The etymology of Manhattan clam chowder. I don't know.
Yeah. I mean, with all the Italian food in New York City, I wonder if it's the percentage
Probably.
of Italians. All right. So yeah, healthcare is, just kind of building a foundation here, Ed. This is all you cover. You've got your own podcast.
That's right.
Remind me, Risk Doesn't Sleep. Is that the name of it?
Yeah, Risk Never Sleeps. Yeah, Risk Never Sleeps. And I'll tell you how I came up with the name, because it's sort of give you a sort of a view into how we think about healthcare risk and security. In most organizations, most industries other than healthcare, things are 9 to 5 for the most part, right? In healthcare, it's 24/7, and so nothing ever shuts down in healthcare, especially from a hospital perspective. And so this notion that risk never sleeps is real in the healthcare context, because it's always on, it's always there. It's with the people that check in the morning, it's with the people that leave, right? The human aspect of risk It's with the technologies, the medical devices, the applications, the operational technologies such as MRI machines, et cetera, that are
Right.
running continually to keep healthcare in motion. And so
It,
this notion of it never sleeping is so critical and so important from a standpoint of how do you deal with it,
right.
and how do you have to change the view of how you look at risk if you're coming from another industry into healthcare.
Right. Like a hospital seems like a 24/7 machine that's just always on the brink of disaster. Like it just needs a little nudge. Just needs, and we saw a lot of research come out of CISA. My friend Josh Corman worked at CISA for a couple of, do you know Josh?
I know Josh well. Yeah. In fact, we did a research study right around the same time Josh published his. Basically, it was qualitative in nature to really understand the impact that ransomware was having on patient safety. And we had heard anecdotes, but I wanted to understand qualitatively whether or not it was actually causing mortality rate issues. Was it causing disruption to care, maybe through ambulance diversion or getting labs or getting x-rays, et cetera. So we ran a study. Josh called me. We published it on a Wednesday. He called me that day. He's like, "Hey, what's the methodology you use with your study?" I said, "Hey, Josh, why are you asking?" He goes, "Because we're putting out a study in 2 days, which is quantitative in nature. It's going to back up everything you just actually put out." And so it was an eye opener, I think, for a lot of people, and it really changed the way that the government, HHS, CISA, and other agencies began to look at the impact of ransomware in healthcare, and specifically about the impact it could have to actually patient safety and patient care.
Yeah, and one of the things I learned from Josh when he put that out is what that knife edge is like. If you delay care by like an average of 10 minutes, the mortality rate can spike. So it's really tough to draw like direct causation, lines between a cybersecurity event and mortality. But it's just a fact that anything that impacts, the ability to deliver care in a timely manner will result in more deaths.
That's right. And if you're in that ambulance and having a heart attack and your ambulance gets diverted because of a ransomware attack, you don't really care about the study.
Another 20 minutes or 30. Yeah. Right.
Yeah, because
there's only so much you can do in the back of an ambulance.
That's right. Exactly. Yeah. Time is muscle when it comes to that, heart muscle.
So yeah, generally, I think when among IT and security folks, when healthcare comes up, there's kind of a collective, grimace, like, oh man, that's a rough environment. Like you're fighting for budget all the time. There's a bunch of stuff you can't do. There's a bunch of stuff you can't touch. Like it's generally just regarded as this really tough environment to do cybersecurity in. Because it's not a homogeneous environment. Like you're saying, you've got OT systems, IT systems, even attacking the billing system, is going to have a huge impact, as we saw with Change Healthcare. So maybe let's talk about that a little bit. Maybe some, I think when we prepped for this, you had some great examples of how different it is from a normal environment that a security team would have to protect, right?
No, that's a great perspective, and I've done 11 companies in my career, all prior to 2010, all in different industries, with the exception of healthcare. Because when I looked at different industries, healthcare was always at the bottom of the list in terms of the amount they invested in new technology, emerging technology, and I tended to be on the cutting edge of disruptive technology. With that being said, 2009 comes along, high tech and ARA. Which put some money out there for a complete forklift upgrade to the technology stack that health systems were using based on the Obama administration. That really made it, a lot more possible for emerging technology to be on par with the financial industry, if you think about it, comparing the two. And so when I entered into that marketplace for the first time, I learned so much, and most importantly, I learned that I thought I knew healthcare, and I had no idea about healthcare. I mean, that was the biggest aha. Healthcare is very different than everything else, and if you treat it like a vertical slice off your website, you really don't understand healthcare. The people are different, the operations are different. Doctors don't sit at a desk every day; they sit at multiple desks and laptops and devices
Yeah,
every single day.
they're
Different
not even
floors, different
employees
rooms.
in most
They're not even
cases,
employees. Right. That's right.
right?
They're not
They're
even employees. That's right.
contractors.
That's right. Exactly. So this notion of identity management and how they interact with computers, and this notion of saving clicks. When I heard that phrase for the first time, saving clicks, that was the big light bulb that went off, because I had never heard anyone refer to saving clicks in any other industry. Now all of a sudden it's front and center. It's the language that providers, that doctors and nurses and others would use as they related to the interaction they had with technology. It's too many clicks. I need to save clicks. It's hurting my workflow. I can't see patients as many patients as I used to now, because I have an EMR I have to interact with, right? So this notion of saving clicks is so central to how, when you're in healthcare, you design software, you design applications. The other piece of this, the other pillar, is security, right? It's not good enough to check boxes. You really have to have secure by design, secure by default applications, because not only we talked about patient safety through ransomware, but there's also loss of data that's heavily regulated through HHS and the OCR, through the HIPAA statute. So these things are really unique to healthcare and important, and require a different approach, not just from a technology stack, but most importantly, through the understanding of workflow. That's really
Yeah.
what's core to the healthcare, success in healthcare or otherwise.
So Adrian and I had talked a little bit about, why it seems like healthcare is one of the areas where it's really hard to be disruptive. And I think a lot about the fact that in big municipalities, you have these kind of more modern hospitals, but once you get out into these more rural areas, you'll have
Mm.
like an emergency care center, maybe one every 300 or 400 miles if you're lucky. And so, how do you think about the trade-off for some of these smaller healthcare companies with investing in modernizing and saving themselves versus, I think we're seeing a lot of planned obsolescence in healthcare where there are no quote unquote right to repair laws for the most part. We're just kind of starting to see legislation over that. So is some of this because hospitals can't afford to make that investment because they can't rely on the technology they're supposed to be investing in to be sufficient for the amount of time it would take to, I guess, recoup that ROI? Is that something you think about?
Oh yeah, no, especially the weak link in healthcare is the rural communities, hospitals, the critical access hospitals, 25 beds or less, that are servicing remote populations, and it's a real issue in the U.S. and in other countries, quite frankly. But it's a little more complicated. It also includes, they may have the investment, but they don't have the resources. So part of the challenge is it's not just the investment might be small for the technology or tool, but if I don't have the resources or the ability to actually manage it on a long-term basis, then I'll spend the money elsewhere. And I think that's part of the trade-off with with a CISO or a proxy for the CISO. Many of these hospitals don't even have a CISO. They might have a proxy level individual, maybe director of security or someone that is acting as the CISO in that role. And that's part of the issue, right? And so you see a lot of these services that have been created to create virtual CISOs to augment the staff that's required for these smaller organizations. So it's technology, but it's also the ability to actually manage and deploy the technology and leverage the technology that causes most of the angst.
Do you find that vendors are hesitant to sell the services necessary because of the ongoing
Yeah,
costs? So it's
yeah,
easier to just sell the point
yeah,
of sale solution and not say, oh, by
yeah,
the way, you're going to need
yeah, yeah, yeah.
$50,000 a year in
No,
pro services.
absolutely. No, you're spot on. Absolutely, people make decisions all the time based on what's right for the business and the profit. And one of the things we did, which is unique, and again, because you know, healthcare is more than just a industry for us; it's a mission. And so what I love about healthcare, which you don't see in any other industry, is the shared mission you have with your customers. They sit literally on the same side of the table, because if your mother, father, sister, brother, aunt, uncle, friend, cousin is hooked up to a device or in an ambulance and it gets diverted, and they do have a mortality incident, now it's personal. And so that mission becomes personal, and everyone is a customer of healthcare, either today or in the future. And so it's really important for me, as much as we can possibly do, to ensure that we balance this profit, need, desire, goal, objective, whatever, with also giving back to the industry and serving alongside those individuals that we have that shared mission with. So we provide a level of services and support and access to rural community hospitals and others that can get and gain benefit and access to our tool set. A slice, it's not the whole thing, obviously, but we think it's a big benefit for those hospitals, because they can get a real sense of how they are doing relative to their peers. And that alone really can help them as they think about planning and preparing for investments and making the right investments. Hey, we're doing really well here. We're not doing so well here. Maybe we should put our money here versus trying to spread it thinly across all these different cybersecurity domain areas, right?
So, before we wrap up the conversation here, it sounds clear like the margins are thin in healthcare. They have to be very choosy where they put that budget. Between the buyer and the seller, there's always got to be some level of compromise, right? On what they're able to do and what you can sell them. Have you been in it long enough? Have you seen ransomware and the frequency of these events and how they've impacted? We've seen how they've impacted hospitals and healthcare in general. Has that moved that at all? Has that moved the willingness to compromise or the availability of budget or moving money around, making more money available for this kind of thing? Or is there just nothing to move?
Yeah, no, it's definitely raised the awareness of the issue at a level that didn't exist when it was just about the data, right? Because obviously, if the data gets out, it's a problem. It could be a problem if it's your data. It could be embarrassing. It's very different than financial data getting out, and mostly people are made whole if they lose their credit card number or whatever, right? And healthcare is very different. Obviously, if the genie's out of the bottle, your data's out of the bottle, and it can be obviously embarrassing or whatever. But data is not death. Like data, you can recover from a data incident. You can't recover from a mortality incident. So I think that has definitely raised not only the awareness of the operators and leadership, but the board as well. And so they're having much more substantive conversations about risk management and where to spend their time, where to spend their investments, and how to basically manage risk, because risk is a business decision. It's not a technology decision. Never has been, never should be. And so the business really needs to understand the risk as it relates to shutting down the hospital. Look what happened with Change Health. The big risk there was people had no idea the breadth of change related technology that they had deployed in their organization. The first reaction, I was at Vive when this was happening, and I was with customers, and they're like, "Oh, we're good. We don't have change." And then they realized, "Oh my God," like 3 days later, "Oh my God, we have change." It was a part of a product that was acquired by Change or part of UT or whatever, right? So like all of a sudden, people realized the impact was much broader than people thought, 24 or 48 hours ago. And then the realization became, how quickly can we recover, because we only have so much cash on hand? And that was the big aha moment for people. We only have weeks of cash on hand. And I think that right there, the Change Health experience changed the way boards, leadership really talk about risk and talk about cybersecurity.
Yeah, and third-party risk management. I think more and more as we depend on third parties to manage security, to manage IT, billing, everything that's hard to do internally or doesn't make financial sense anymore because there's some kind of SaaS component now.
Exactly.
Now we're finding out we've got these third-party problems. We've got these fourth-party problems, right? I think it was Kaseya that got hit, and the co-op grocery chain in Sweden shut down, not because they were doing business with Kaseya, but because their payment vendor was doing business with Kaseya. So they couldn't have known that, but their operations were shut down all the same.
Mm-hmm. Exactly. Yeah. And oftentimes that happens even with things like revenue cycle management, right? Which is a smaller instance, isolated instance, but on the back end, the billing system could be run by a mom and pop organization that has no cybersecurity practices or protocols in place, and they get hit. And now they've shut down the front end of the RCM capabilities of a business. Obviously not at the level of a change, but still important to that individual health system.
Yeah, we still haven't developed like a V-bomb or like a good, equivalent of an S-bomb for vendors. And it's increasingly becoming the happy vector of attackers because vendors are 10, 50 people.
Bang for their buck.
Yeah, absolutely. That's who I would
hit
target.
200 customers at once.
Yeah, that's right. That's right. And on average, they have over 1,300 vendors that they quote unquote know of, but there's probably another 30% that they don't know of that we find, and they're forced because they only have so much time, so much money, so many resources to do some type of artificial stratification of risk without actually doing risk assessments, right? And I think that's the danger. And
we were talking about this last week.
Yeah.
You get the SOC 2, but if you don't actually read the SOC 2, what's the point of getting the SOC 2?
Exactly. And it's a point in time. Like, what happens like after the thing is published? First of all, if you're a SaaS company, it's probably already out of date before it even hits the wire, right? So yeah, there's so many issues. And it's a false sense of security people have to these certificates and SOC 2. And they're definitely necessary, but they're never sufficient. You definitely need to take much more of a life cycle, continuous monitoring approach to risk across the relationship you have with that vendor from cradle to grave and all points in between.
Apropos for healthcare.
Mm-hmm. Well, Ed, it's been wonderful. It hasn't been the cheeriest of conversations, but I am glad to have had it with you. Very enlightening. Thank you so much for coming on the show. I appreciate it,
folks. I appreciate your time. Thank you.
All right, stay tuned. When we come back, we're going to talk with Tanya Janka about her new book, Alice and Bob Learn Secure Coding.